Hi, I'm Christine Adkins, and I was diagnosed with HER2-positive, ER-positive breast cancer. It's a stage 3 aggressive cancer. There is no stage 1 or 2, but it is possible for it to move into stage 4. So it's very imperative that you get it taken care of as quickly as possible. The original plan was to do 6 cycles of chemo, then the mastectomy, and then radiation, and then hormone blocking pills for 5 years. That changed when they found out that it was all localized after my PET scan. My oncologist met with other oncologists. I think there were 6 or 7 of them. Because this type of breast cancer is a little more difficult to treat, because while you're treating it with chemo, your hormones are feeding the cancer cells. But you can't treat the hormones at the same time, because studies have shown that if you use the hormone blockers along with chemo or radiation, it actually makes the drug inactive. So it stops working, which you don't want to do. You want it to work. So this type of cancer poses a slight problem in treatment. So that's why they were all meeting together to make sure that they made the best decision for my health. And I really appreciate what they did, that they talked to each other. And again, God's timing is perfect, and He has a plan. And He's had a plan since day one, so I'm not going to stop trusting Him now. It was a little bit of a blow, because I thought I was going to have time to think about it and sort of prepare myself to have that done. I thought I had 4 months or so. But there it is. So 3 days after my PET scan, I went in for surgery, and it's during the pandemic. So, my husband wasn't allowed in with me. My daughter wasn't allowed in with me, which is fine. I've gone in for surgeries by myself before. This was a little more invasive from what, some other things that I might have had done, like my shoulder or, things like that. But I was okay. I had Jesus Christ with me. I prayed. I felt His presence. He gave me peace. He gave me confidence. I missed my family. I wished it was boring. I really wished that some of them could pop in afterwards and, sit and chit chat for 15 minutes, just kind of break up my evening or my day. I know that sounds a little selfish, but I did miss, having my family around, because I'm around them all the time. And you have to fill your time. There's not a lot you can do laying in bed for 2 days, and I'm not that type of person. I constantly move. If I throw a television show on, I'm still doing laundry or something at the same time. So sitting in a bed for 2 days was really hard. I packed crossword puzzles, pen, phone charger, what else? An extra set of clothes just in case, just really comfy pajama pants, lightweight, a camisole top, snacks. Our hospital where I went to does not have a kitchen 24 hours a day. They have certain hours that they serve each meal, and you have to order it by a certain time. And then the kitchen closes, after dinner. So I brought Advanced Formula Slim Fast, which has 20 grams of protein. It has, I think, 1 gram of carbohydrates. It is lactose-free. It's gluten-free. So I like it because of the 20 grams of protein. A regular Slim Fast does not have that much protein. So I brought 2 of those. I brought little bags of chips and snacks and stuff. As long as you have them in your bag, I brought like a little rolly suitcase, not something giant, but not too small, just big enough to fit everything in. I asked the nurse about it when I got there, and she's like, it's in your bag, don't worry about it. I was like, okay. Sounds good to me. What else? Oh, earbuds. Earbuds, because if you end up with someone in your room and you want to watch TV all night, and I did, because after they knocked me out in the evening, I got there fairly early. They didn't do my surgery till the afternoon, and I was out for hours. I mean hours, because they had to do the surgery. They had to take lymph nodes that had shown to be positive. They had injected me before the surgery with a dye, so that during surgery they would be able to see what lymph nodes were positive. So they had to do that. After they took the lymph nodes out, they had to send them out to get tested immediately while I was under still. And once that came back and they knew which ones were positive, then they finished and they took out 4 lymph nodes as well as the full breast. So when I woke up, I was in my room and propped up. I had, bandage wrapped all the way around, a compression ace bandage. It was just regular, really wide ace bandage wrapped around, nice and tight, not too uncomfortable. They did a really good job. I was not uncomfortable. It was perfectly wrapped. I had a surgical bra that Velcros down the center. I still have it because it's the only thing comfortable I've been able to wear until I get something that's made for breast cancer patients that's a little more comfortable. The ones at the store, all the ones I have, I can't, they're not made for what's going on right now. So I'm going to wait patiently. And until then, this surgical bra has been my best friend. I hand wash it. I let it hang dry overnight, put it back on the next morning. It's been great. It's comfortable. It's more comfortable than any sports bra I've ever tried on. It's very nice going to appointments because it has Velcro on the straps here on the top. And it also has Velcro all the way down the middle. I have a shirt on over top, just so you know. So after surgery, of course you have medicine you can click. I didn't want to click it too much because I wanted to make sure that I knew how much pain I was in without covering up, too much at first, just to kind of gauge, because you're not going to have that when you go home. So I just kind of used that lightly if I was really, really starting to feel a lot of discomfort and pain, just so I could relax. Watch TV. I was up all night because, I wasn't comfortable. I had 2 drains, one here and one a little lower. So I had 2 of them. They showed me, how to empty them. You have to measure the liquid that comes out. You wait until it has like about 20 or 30 milliliters in it. You don't want it to get too full. Do not allow them to get all the way full. That's not the purpose of the drain, okay? Once it gets to past a certain point, it stops suctioning what's supposed to come out. So once it gets to 20 or 30 milliliters, you need to dump it and measure. You need to write it in your log, which they showed me what I need to do. And just keep an eye on it. Make sure it's going. If you see anything that looks like a red worm or something, don't panic. It's normal. It happens. Stuff besides the fluid is going to come out of the drain in the tube. What you need to do, and I looked this up on YouTube, how to milk the tubes to a drain, a surgical drain. And what you do is you start at the very top where the drain is inserted into your skin. You have to hold the top so you don't pull the drain out. It's going to be stitched in place. Don't pull on it. Hold the top of the tube very firmly with one hand. Take your other hand, squeeze the tube as close to the top as you can, and literally pull and squeeze. Pull and squeeze. And then move your finger down, pinch it, pull and squeeze until you get all the way down to the pouch. Okay? And you just keep doing it until you get all the way to the opening of the pouch where all the stuff drains into. You have to do that. You do not want those tubes to block. So if you see anything that doesn't look like liquid, do that. Don't be afraid to pull on that tube. It's a strong tube. It'll stretch a little bit. You know, don't rip it apart, but just, you know, give it some muscle. Get that stuff out of there. So I had to do that a couple times because they did end up with stuff blocking, and I noticed it wasn't draining, but there was stuff in the tube, but it wasn't coming out into the pouch. So I found out, you know, I had to milk the tubes. And you can look up videos on how to do that on YouTube. They'll describe it to you how to do it. What else? Don't let them take your drinks or food away from you when you're at the hospital. If you ordered dinner, and where I was, they allowed you to order 3 separate drinks with your meal. An entree, like 2 or 3 sides. It was crazy. It was a lot of food. I ordered the full meal. I picked what I wanted, what I thought I could eat. I was a little nauseous. They hadn't really given me anything for nausea yet. You know, get it all, because you don't know what you're going to be able to eat and not eat, and you don't know if you're going to be hungry later. And like I said, I packed my snacks, but, you know, is it going to last you all night when you're awake and you're alone and bored and you want to eat? Probably not. I had asked a nurse if I could go to the bathroom. I'm sorry, it was an aide. It wasn't the nurse. I had pushed my button for help and said I really need to go to the bathroom. It's been like hours. I need to go. And also, you know, I need to drain my pouches. And she said, okay. You know, she helped unplug my IV from the back, wrapped my cords, you know, so I could take my little metal pole into the bathroom. I had hot chocolate, coffee, and juice left over. I was kind of working on the juice. I was saving my coffee because it was after dinner time. I was going to drink my coffee. It was already made. It wasn't quite room temperature yet. It was still warm. I was going to sit there and watch some TV, sip my coffee, and just relax. And then, you know, later on, FaceTime my family. So I was really looking forward to that hot chocolate and coffee. Went to the bathroom, came out. Everything on my tray was gone. I was so sad. I said, where did all my stuff go? And she said, oh, I threw it away. I got rid of it. And I said, well, why? Oh, I thought you were done with it. No, I hadn't even touched. I was saving that. I was about to drink that. You know, I was kind of upset. I was trying really hard to be nice about it. She really didn't mean to, but she shouldn't have gotten rid of anything without asking. Okay, and they shouldn't. So if you get up to go to the bathroom and you have stuff that you do not want thrown away, forewarning, speak up. Say, look, I'm still working on this stuff. Could you please leave it here? I mean, if it's something that they're afraid is going to get bacteria or spoil, like eggs or meat or something, of course, if you haven't eaten it in a couple hours, you need to throw it away. But if it's like a drink, you know, a coffee or what, it's fine. Don't let them take it if you want it. Like, say nicely, say, please leave this here. I'm going to drink it. Don't touch anything. Well, fortunately, the nurse had come in, and I remember her mentioning that they had coffee in their break lounge. And I told her what happened without trying to be sounding like a jerk. You know, I said, you know, she accidentally threw it away. You know, I was really looking forward to drinking some. I've been looking forward to coffee, you know, all day. This is the first opportunity that I've been able to drink it. I really, really wanted to drink it. And I said, you said you had coffee in your lounge, right? And she said, yeah, but it's, you know, it's been there all day. It's probably cold and gross. And I'm like, I'll take it. If you are willing to bring me a cup, I will be thankful for whatever you give me, you know. And she's like, well, what do you want with it? I was like, anything you got, whatever you got, I will take. I will take gratefully. This nurse came back with a nice big mug of hot coffee she nuked in the microwave with creamer and sugar. And I almost wanted to cry. I just thanked her over and over. I don't think she realized what that cup of coffee was going to do for me. Don't be afraid to speak up. Don't be afraid to ask for your needs and some wants. You know, don't be a jerk about it. But, you know, if they say no, they say no. But what's the harm in asking nicely? You never know. I mean, if they're having a good day and they, you know, you've been nice the whole time and you've been a great patient, maybe they'll do something extra special for you. I don't know. But that nurse was just awesome. So I had my coffee. I FaceTimed my family before it got too late. And that was really awesome. I really missed them. No one was able to come and see me. But the next day, you know, I took naps off and on. I wasn't able to sleep through the night. Maybe you guys were able to if you had one done. Or if you're going to have one done, maybe you'll be able to. I was not. I was like asleep for an hour or two, then I'd wake up and I'd be awake for like 5. And then I'd sleep and I'd be awake. And then, you know, so it was very messed up sleep schedule. Was not normal at all, but, you know, I was just coming out of surgery. What do you expect? So I did utilize a lot of stuff I brought. I had brought a little book of devotions one of my sister-in-laws had given me, so thank you. I read one of those and I just prayed. I talked to God, watched TV, binge watched some of my junk shows, watched YouTube, you know, listen to music on my phone, plug my phone in. They have USB plug-ins on your bed. They can also plug it into the wall if you have a regular outlet plug behind you. So don't forget to bring that. You don't want your phone dying, especially if you want to talk and text people. And I texted a few people. Didn't really feel like talking too much. I was very tired and sore. What else? I think that's about it. You know, when they told me they were going to discharge me, they gave me a bag of, you know, bandages and gauze and things like that. My instructions, how to care for everything, when to change everything. Every other day, I think I had to wait a few days, and then I was able to, you know, change the bandage, take the compression ACE bandage off and change the bandages underneath over my wound. I had my mother-in-law, who is a nurse, do it just so it was done right, but I'm sure any normal person will be able to do it if you follow the instructions. They were pretty easy to follow. I didn't want to look at it, honestly. I didn't want to see it right away. I wasn't ready. Like I said, I didn't have time to prepare to have this done like I thought I would, and I did not want to see my body incomplete at that moment. So I waited. I waited until it was completely healed. I waited until I went back to the doctor, the surgeon, and got my first drain taken out. and that hurts. You'll live through it, but it hurts. There's literally a foot of tubing for each drain inside your body, wound around. I didn't know that. I thought the tube was like this long. I was so afraid of knocking the thing out of my body. I was so super careful because I thought there was only this much tube in there. Here it was this much tube. So even if it moved a little bit, it still would have been in there. Well, the nurse, you know, puts a hand on you, grabs the tube, and really fast. Oh, the friction of the tube coming out of the tiny healed hole that the skin had started to heal around the tube. And, you know, they cut the suit, you know, they cut the threads and everything, but pulling that out that fast, the friction alone and feeling that tube going out of your body. Ugh. I wasn't ready for that. Nobody said anything about that. It hurts. It burns. The friction burns from the inside out. But, you know, I didn't cry or anything, but I was like, whoa, hold on. And she's like, you're done. I'm like, oh my Lord in heaven. I was not ready. But, you know, the second tube and drain had to stay in. It was still going pretty strong. After another week, the surgeon just decided, like, we need to take this out because you run the risk of infection if you leave it in too long, even though it's still draining really well. And I said, okay, like, are you sure? I don't really want to have it taken out. I know how it feels. But I went in and they took it out. It has been 3 weeks since the drain was taken out. I am still filling up with fluid a little bit and it's still puffy. It hurts a little. I'm just keeping an eye on it. I talked to the surgeon twice about it, you know, just to ease my mind, make sure that I wasn't in any danger, because if you have too much fluid buildup, it's not good for you and it could be dangerous. And you need to go in and get it syringed out, which I didn't really want to do. So I kept a close eye on it. I called my surgeon's office 2 different times in the 3 weeks just to make sure that the symptoms I was having were not indications of something really serious going on. And he said, you know, you're doing fine. You know, unless it gets really, really bad, you know, we don't want to syringe you. We don't want to put your body or your wounds through any more trauma. And you're in chemo right now. So, oh, I started chemo 2 days after I got my last drain out. So after I got my last one out, my second one, they started my first chemo treatment 2 days later. So I was really cutting it close. I wasn't even really healed from that. And they just said, you know, we don't want to stick you with a syringe and be pulling out fluid right now. So I was like, okay. So I'm doing okay. The wound healed. You know, everything looks great. Suggestion: if you plan to have reconstructive surgery after your treatment is completely finished, please ask your surgeon to leave as much extra skin and tissue as humanly possible. You need to tell them this. They don't automatically do it. And if you tell them and they say, oh, we were already planning on doing it, that's fine. That's fine. But as a patient, I really strongly suggest, if you are getting reconstructive surgery at some point, have them leave as much extra skin and tissue there as possible. It's gonna look weird, okay? It's not gonna be like a completely flat, you know, area with the surgical sutures across, you know, in a nice line. It's going to look a little funky, but here's why I strongly suggest you do this. And this is really important. If you're going to have reconstructive surgery, this will save you from going in many, many, many times to get the skin that's left stretched out enough to match your other one, whatever size you are. You could be tiny, you could be big, it doesn't matter. If they don't leave any extra skin and tissue, whatever size your other one is, whether it's small or big, they're going to have to slowly stretch where your boob is missing. And that could take a lot of time and a lot of visits. And, you know, depending on how much you need to stretch the skin, if they didn't leave any extra, you're only going to be able to go so big. They can't stretch your skin past the point of where it's not going to be healthy. You know, there's a limit. So if you're going to have reconstructive surgery, no matter how big you are, what your size is, ask the surgeon. Make sure you make it clear, I want as much extra skin and tissue left as possible. Okay, I'm planning to have reconstructive surgery done. I don't want to go in multiple times to have my skin stretched out, whatever little skin is going to be left. Because if you don't ask them and they don't do that extra skin, there's nothing there. You know, they stretch the skin till it's like paper thin. You don't want to do that. That's not good. So, you know, that's my suggestion. I had my surgeon do that. You know, do the research. Look up videos. Look up articles on people that have done it. Watch videos by oncologists. There's lots of them out there on YouTube. You can find them on pretty much any procedure you're having done through this whole process. Ultrasounds, mammogram biopsies, skin biopsies, lymph node biopsies, plain old mammogram, PET scans, anything you are going to go through, I would research it and make sure that it's done by a doctor or a patient who has gone through it. Your experience isn't going to be exactly like mine. My experience isn't exactly like the people that I've watched on YouTube go through these things, but they gave me a lot of helpful tips and, you know, things that normally your doctor isn't going to be able to talk to you about every single little thing, okay? One, you don't have the time in a visit, and two, it's just so much information. You know, they are there to give you the really important points of your treatment and what's going on. Be a good patient. Get out there and research. It's not hard. Watch a couple videos, be informed, so that you can sort of have a conversation with your doctors about your next step, your treatments. I had raised concern about my estrogen responsive part of the cancer, saying, you know, if we're going through all this treatment, isn't the hormones going to be an issue? And they said, well, yes and no. That's why we did the surgery first. If we would have done chemo, then surgery, then it would definitely cause a bit of a problem because we'd be, you know, killing all the cells at the same time. Your estrogen would be feeding the cells. So, you know, I feel that they made the right decision. I had prayed over them. I prayed for God to guide them in the right direction and that His will over anything be done. I did share my heart's desire. I told God, I want this cancer out of me. You know, but overall, I want your will to be done. So whatever that is, that's what I want. But I did share my heart's desire, and He fulfilled that. He got me surgery first, and now it's chemo, and And then we're just going to trust him and rest in him, even on the rough days, which there will be rough days. So, but that's all about my mastectomy. I hope I covered as much info as I could about, you know, my surgery. Of course, I wasn't awake for the surgery. Post-surgery visit in the hospital and kind of the aftercare. Like I said, you had to check your drains, drain it into a cup, measure it, log it. You have to take your log to your surgeon when you go in so that they can see, you know, when it's time to pull the drains out. I suggest an ice pack. After my first drain was out, the second time I iced it. I had a big gel ice pack and I just put it right over where the drain was inserted and just numbed it as best I could. You still feel a little bit, but it's better. And if you have any topical lidocaine, that's good too. But you don't need that. I mean, take some Tylenol. Don't take ibuprofen or anything. Take Tylenol and an ice pack before you get your drains out, and just, you know, put a clean towel in between. You don't want to put an ice pack right on your open wound. You don't want to introduce bacteria. Make sure there's something clean in between. And plus, it's not good to put something that cold right up against your skin. It can damage your skin. So, you know, a very thin towel, just put it in between your ice pack and hold it there, and go to the doctor and have your drains taken out. What else? Don't be afraid to call and talk, you know, ask about your concerns. You're not bothering them. It's their job. And the last thing they want is for a patient to have complications or get sick or die because you didn't want to be a bother. You're not bothering them. Now, if you're calling them every day and, you know, if you have a legit concern and you are afraid for your health, call the office, talk to a nurse, you know, see if the surgeon needs to talk to you, see if you need to go in. You know, don't be afraid to share that serious concern. It's your health, it's your life. Take it seriously. It's okay. But other than that, I know this was a long one. I just wanted to try and cover everything about the mastectomy that I could possibly remember and just share some things I learned.